Let's get an update on the coronavirus figures in the UK now. We understand that there are 319 positive cases in the UK, 24,641 negative tests. So 319 people have tested positive in the UK. That's up from 273 at this time yesterday. Let's bring in our correspondent, Ashish Joshi, who is here with me. Ashish, a jump of 46.
A rise of 46, and what the clinicians and the scientists will be looking at is when they're doing their modelling, when they're looking at the figures rising, they'll see that there's been a bigger rise prior to this. So I think over the weekend there was a rise of 67 and then 46. They'll be able to make sense of the numbers and what that actually means. We know about the cases, the two in Wales today. I think there's one in on the Channel Islands. And the other key figure here are the 3 patients who've tested positive for coronavirus who have died. So no more fatalities. This is the number that's issued by Department of Health at 2 o'clock every afternoon. So we can see a rise there of 46 more positive cases. So the numbers themselves look like, you know, it's difficult to say at the moment, but they do look like they're stabilising. What we were expecting over the last few weeks, when you listened to the experts who had been watching developments in Italy and China and South Korea, those figures doubling day by day, but certainly the contingency plans put into place by the government seem to be holding.
Yeah, and as you say, looking for patterns and looking for that trajectory rise. This isn't the highest daily rise that we've seen, but still up to 319. But that key figure, 3 patients have sadly died.
Yeah, 3 patients have died. The ones who all, and this, we need to stress this, who were all in that age group who are most at risk and who all had underlying health concerns. The Department of Health, the government, the Chief Medical Officer, they are at pains to tell us that this is a very serious virus. It will affect lots of people because of its transmissibility, high infection rates, but the people who are most at risk are those with underlying health concerns who are in the higher age groups, 60, 70, 80 plus. For the rest of the population, not so serious, but of course the danger is that you're spreading the virus on to people who are, or parts of the community who are more susceptible to the virus. But certainly the figure today, the key figure there is, it's a rise of 46, but not as high as it has been over the last couple of days. And I'm sure the government scientists, the people who model these numbers, it's not straightforward maths. It's not a percentage. You know, it's not how many people have been tested, therefore you arrive at this figure. Some very serious modelling takes place, and they'll be able to make sense of these figures and hopefully tell us whether they're on top of the situation.
And also that contact tracing, of course.
Yeah, the contact tracing is critical, it's key. And I think a lot of people who've been looking at the situation in Italy have said the government here has done a very good job. As soon as a patient has been identified, contact tracing kicks in, and they've been able to isolate the people most at risk of being infected by the one person. Because if you do that, then you are, and you've heard this over and over again, Sarah, over the last few weeks, it's the containment phase. If you can contain the virus, if you can stop it spreading, then you can be pretty much on top of it, and you don't need to move as quickly as you would have to into the delay phase. So at the moment, it looks like the contained strategy is working for the government.
OK, let's find out a little bit more about the government's response now, because the Prime Minister's spokesman has said the UK's response to the coronavirus outbreak remains in that first containment phase. And that follows an emergency meeting in Downing Street this morning. But Number 10 says it is now accepted that COVID-19 will spread in a significant way.